Hello and welcome. My name is Libby Kosterman and today I'm joined by Sue Thomson from McClean Care. Welcome, Sue.
Thank you very much. Pleasure to be here.
Sue, look, thanks for joining us today. We wanted to talk a little bit about how you're using the Aged Care Leadership Capability Framework. But before we get into that, perhaps you could tell us just a little bit about McClean Care.
Certainly. Libby, McClean Care is a community not-for-profit organisation, and we actually have the privilege of being one of the largest community care providers in the New England and Northwest. And what's special about us is that we are community owned, and what we do is genuinely for our community, and we are very, very passionate about what that means.
And you're the CEO there, Sue?
That's correct, yes I am.
How long have you been in that position?
Early tenure, about 7 months, so not very long at all.
Interesting times.
Very interesting.
Look, as I said earlier, so we wanted to talk a little bit about the Aged Care Leadership Capability Framework and how you're using that at McClean Care. And I understand that you're actually embarking on a kind of a cultural change program. Can you just tell us a bit about what you're hoping to achieve and how you're going about that?
Yeah, Lydia, basically we call ourselves a value-led organisation. Our mission currently now is to truly be a values-led organisation, which means that you know, we have some work to do with our culture. And part of that cultural change is about developing our leaders and particularly targeting the level 2 and the level 3 group because they're the most, or the level 3 in particular, because that really is the registered nurses and coordinators to carry forth a core set of values which are translated into the workplace to ensure that our values are upheld, and hence, you know, we can then deliver the type of care that needs to be delivered.
And so, you know, it sounds like the values are the core in terms of that change. Can you tell us, you know, what it is that you're actually hoping to achieve as a result of the project or the program?
Yeah, what we're hoping to achieve is that we have a culture where the person that is in need of the support or care, and that is in either residential care or community care, is at the very centre of that support, and the support is delivered according to what that person wants and needs. So they become centric, if you like, to the whole model.
Fantastic. And so where's the Aged Care Leadership Capability Framework fitting into this for you, Sue?
Where this fits in, we've done some work previously with some of our managers in terms of leadership development, and we've had some changes in our management structure. So what we now need is to develop those managers as well as some of the key level 3 people. And so what we had been looking for was a model that would support a structure and a learning environment to allow our level 2s and level 3 leaders to develop. And so when you look at the Aged Care Leadership Framework, the 5 domains are some of the most important domains in terms of leadership, and they are central to, for example, the first domain is self, to develop the self. So if we have our level 2 and level 3 leaders embracing that particular domain, then if they're developed within themselves, then they can go forth and literally carry that leadership into the workplace. And we find, particularly with registered nurses, we talk about clinical governance. Clinical governance, a framework of any description cannot work in the workplace unless you have that element of leadership, and that has to come primarily from your registered nurses and enrolled nurses. So that's another key element that we are addressing at the same time.
That's really interesting, Sue, and particularly as you're talking about, you know, the importance of that self domain and as a kind of, it's almost the starting point, isn't it? The leader needs to believe in themselves as a leader, and then that can be demonstrated and modelled and further developed from there.
Yes, that's right. Unless you have an insight into yourself and what you need to do in terms of to be the leader that you need to be, then any other foundation that you try to lay will not bring about the result that you're aiming for.
And so in terms of the cultural change program, Sue, is there any other way that you've been able to sort of draw from the capability framework to help you with that?
We've been drawing on certain elements of it informally, but not as a formal process, and we've been using some of the domains in there to round out, if you like, planning, and primarily that's really what we've been using them for at this stage is you know, the planning of how we want this change to look like in the workplace.
So Sue, how are you planning to ascertain whether the change you're looking for has actually taken place?
Okay. We will select some key components of the other domains apart from all of the self aspects and really work hard to implement those, and halfway through our project plan we will, and we call it pulsing the organisation to see where we've made some progress and where we potentially maybe need to make some more progress, so that when we get to the end of the actual project plan, which to us is, you know, the signifying the end of the culture change process, if you like, we will then pulse again, and we may well need to check in between those as well, depending on you know, what we have to move around and refocus on and so on. So it's largely start the process and see where that's going to lead us.
And to sort of, and those touch points will provide you with indications as to how things are really progressing.
Yes, yeah. So, you know, that will then determine when we look at where the culture is sitting at that point in time, what we maybe have to refocus on, go back to, or move forward with.
Can I just ask out of curiosity, Sue, how you're going about the pulsing? What does the pulsing involve?
It will involve surveying our staff on the key elements of the changes in our values that we want to bring about. It will also involve surveying some key stakeholders, and primarily they'll obviously be our residents, clients and family members, and to the degree too visiting stakeholders such as our medical officers and so on. So to try and get as a rounded approach as we possibly can. We find like the visiting allied health professionals and doctors actually can tell us a lot about our organisation as well, so we need to make sure that we capture that information from them as well as particularly outside, and they hear lots of things outside as well and can actually have a productive input into what our progress actually is.
That sounds like a really terrific approach, so especially to get that feedback from outside the organisation. As you say, you know, it's a really good way of holding up the mirror to see what's really going on inside that you may or may not be aware of.
Yeah, yeah. We're also hoping actually to make this as painless, if you like, as possible, and try and make it electronic. So that's ultimately the aim, is using technology to its maximum, and that allows us to, you know, flick out surveys really easily to people's email addresses or iPads and so on to come back to us really, really quickly. So I think the turnaround time is really critical as well.
Yeah, and minimising that impact, as you're saying, so trying to make it painless so that people don't feel like they're being surveyed constantly. Yeah,
that's right.
That's fantastic, Sue. Are you planning? It really sounds like the kind of program that might be interesting to other aged care providers. I'm just wondering if you're sharing your process with anybody.
Certainly through the regional groups, we've definitely been talking about the leadership capability framework. So a lot of organisations around the region are seriously looking at it, because it is really, really important in terms of aged care and the impact that good leadership can have not only just on care processes, but on organisational sustainability. So from that aspect, a lot of organisations are really seriously looking at the framework.
I think that's a perfect place for us to end, Sue. Thank you so much for your time today. Really appreciate you sharing that with us.
No, my pleasure.